I'm going to show you how to do an abdominal massage. First, take a pillowcase cover or two and cover the chest of the client. And then you want to secure it on top at the shoulders. And then make sure nothing is going to get exposed while you gently remove the lower covers underneath the pillow. And then work around so that you can gently, obliquely pull down the covers while keeping the cleavage of your client, chest of your client, covered. You might have to secure the pillow above the blankets and then hold at the collarbone and then gently pull down. But if they have a large chest, their breast tissue can fall down and be exposed, so we don't want that. Spend some time doing this so that you don't just rush through and accidentally expose the breast tissue of your client. Once you have that in place, secure the bottom linens and the top pillowcase. Here I'm covering it with another pillowcase just for modesty. You can have them lift their arms up and tuck it under their arms, or you could tuck it under their back, or you could do both. Right here I'm tucking under their arms before I pull down the linen and top cover. This secures the covering of the breast tissue in place so nothing is exposed during the abdominal massage. When lowering the covers, only lower to the top of the underwear line. And you can go up to 2 inches below the belly button line, but you don't want to be in the pubic region. That would be good under the belly button if you wanted to massage, palpate for the small intestines where nutrients go, up to the appendix on the lower right where waste tissue is degraded and lymphoid tissue comes in and breaks apart toxic waste in the intestines and abdominal cavity. Here I'm starting with effleurage. Warm up your lotion by rubbing your hands together or squeezing them tightly together to warm the lotion. I'm doing effleurage with just a flat hand, tracing clockwise along the belly button. And we do this for 3 to 12 strokes. You can do it in circles. This is a half circle because the bottom boundary is higher than below the belly button. If we wanted to go below the belly button, we would palpate for any abnormalities in the ureters that enter the bladder, the uterus that can be behind the bladder or above it if pregnant or having fibroids, as well as referred pain for male reproductive tract as well, can be below the belly button. And we'd secure for sure the bottom linen and top cover. And then right here, then after you're doing the clockwise strokes of effleurage, you gently add more pressure and move up to the side of the belly button 3 to 12 times, and then across 3 to 12 times, and then down 3 to 12 times, and then if below the belly button 3 to 12 times. This stimulates digestion as our used waste from eating is processed. It moves into the freely unattached small intestines of the jejunum and the ileum, and then into the cecum of the large intestine as it ascends on the right where the appendix is for toxic waste matter. And then the fecal waste matter is entering into the large intestine from the cecum, goes into the ascending colon from the lower right to the upper right, and then across the transverse colon where it meets at the hepatic flexure where the ascending colon is under the liver and gallbladder and across to the transverse process. It has to go through that hepatic flexure. The hepatic flexure in that region is a sign of diseases or pain that could be associated with the liver and gallbladder as well. Like here we are pressing, this is called McBurney's sign, where you press in as they breathe and then exhale, and then you press down while they're exhaling, and then you leave it there and have them inhale. And if there's pain, it could be referred pain from a cholecystitis, swollen gallbladder due to gallstones, or swollen liver, hepatomegaly. And then you're going across the transverse colon to the splenic flexure here under the left rib cage. It'll be more to the side and under the ribs, If it was enlarged, it would be following an infection, a viral infection, a bacterial infection, some kind of blood disorder like sickle cell anemia or leukemia, lymphoma. Those areas can get enlarged, as well as the liver in those kinds of immune infections. Then you're going down. You can trace backwards too along the transverse to the sigmoid colon right here, down to the that's the splenic flexure to the sigmoid colon, and then just gently across. And it would be stimulating, promoting, pushing fecal waste matter into the rectum from the sigmoid S-shaped large intestine, where it waits. This right here, you can palpate, also add more pressure and see if there's any pain. You see if there's any ascites, fluid that could be related. But you would also notice extended veins in and around the belly button. There could also be a hernia in the belly button. Some people have hernias that show in the belly. They can also have tumors that show in the belly, from colon tumors or that are very large in colon cancer, or from fibroids in women with extended uteruses due to large benign tumors. Also cancer. It would be painful. It's only painful too in some cancer patients, like PCOS. It might be painful during menstruation, or they would have extended bellies with referred back pain. You can detect all sorts of these different pain patterns around the belly, and the location does matter. But generally it's to stimulate digestion. And right here we're just going to the psoas and the lower back up to the top of the abdominal rectus by the belly button. She has a normal, healthy belly. There's nothing going on with her. No pain patterns, no discomfort. We're using like light to medium firm pressure whenever we massage. You can dig a little deeper along the sides if you want to get into the psoas. It's going to be closer to the ileum though. You'd have to gently push away the belly contents. And interestingly enough, the large intestine is attached, called retroperitoneal, but the small intestines are not attached, so it's only the soft tissue of the abdomen that keeps those contents in place. And after our belly massage, we just tuck back in our client for modesty, and we can begin the arm massage, or if we've already ended the arm massage, and that's the last of the massage, we can end it there. Thank you so much.